Hi everybody, welcome to Healthcare Sucks Plus. And the plus is more and more on the outbreak from China, the China virus. We're going to watch a couple things here and then I'll put a little bit more input. I'm just trying to bring you guys as much as I can, as fast as I can, and then you kind of make up your mind. But with that being said, I would definitely be taking the precautions, washing, less contact with people, definitely less contact with anybody that's been flying, particularly anybody that's been flying from overseas in the Asian area. You're going to hear these guys have no idea where this is going to go. So with that,
Good evening, everybody. Breaking news tonight. This afternoon, the Centers for Disease Control announced that the deadly China coronavirus has spread from China to the United States. The coronavirus has infected hundreds in China, killed 6 people there. It has also spread to South Korea, to Thailand, and Japan. Federal health officials are screening travelers from the epicenter of the virus, the Chinese city of Wuhan, a city of 19 million people. Airports in Los Angeles, San Francisco, New York, Atlanta, Chicago. All screening efforts have been ramped up at those airports. Joining us tonight is Dr. Anthony Fauci. He's director of the National Institute of Allergy and Infectious Diseases. And doctor, we've had to talk about these issues over the years. This one is unusual in that such a small number of cases, both in China, and now we hear about 1 case in the United States. What's going on?
Well, it's an evolving situation, Lou. I mean, yes, there are, relatively speaking, not a lot of cases, but they're accelerating. You know, just a few days ago, there was 40 cases, then 45, then 60. Now there are over 300 cases in China predominantly, right, with 6 deaths. We were expecting that sooner or later we would see a case in the United States because of the extensive volume of travel between China and the United States. So the case that was discussed today in the press conference is not really a surprise.
Right. In Seattle, and I think like most Americans, we were expecting it because precisely what you say, that is the extraordinary international travel. It's hard to keep this contained, particularly when we've heard that the virus, the coronavirus, has moved to South Korea, Thailand, right, and beyond, certainly beyond China's borders. Give us a sense, if you will, as to how the WHO, the World Health Organization, moved so quickly to get to China on what were reported 44 cases, and already the WHO had moved into action a week and a half ago.
see, and that don't sound suspicious. They've already moved on it. They already knew, like I said in my last video, that way back 30 days ago or more, they knew this was coming. They knew it was out there. And they're trying to jump on it. But the point is they already knew this was heading this way. And of course, the public, we the people, are the last ones to know. And heaven forbid they shut down or block travel early way back when because of dollars and monies and the stock market and all that. Because when it comes down to it, guys, healthcare sucks. And so does the system.
Well, you know, it's a combination. I think the Chinese health authorities were the ones that were really moved quickly to address this. Obviously, the WHO is the broad global coordinator. Our own CDC are very much in contact, which is what is going on in China, and they're obviously quite ready for any kind of response should it have any difficulty here in the United States. As you know, Lou, we are, with the Department of Homeland Security, screening individuals at airports, right, the JFK, LAX, San Francisco, and now recently we've added Chicago and Atlanta for entry screening for people that might have symptoms and signs of the infection in order to isolate them should they enter the country.
Has there been any
a lot of
positive
organizations.
contact? Has there been any positive contact among the over 3,000 screenings?
In the screenings, no. That one person came in, entered the country prior to the beginning of the screening entry at the airport. But right now, there have been no positive hits, as it were.
The one person entered the country previously to the screenings. So with one coming in, that means there's more out there, guys, which means there's more people already affected. If you're a nurse or a doctor or anybody in healthcare anywhere in the United States and you've seen this, contact me at healthcaresucks2015.gmail. It'll be attached to the video. And if you want to not be no name, no nothing, I'll keep it totally secret. I just want to know if you guys are seeing it out there and you've been seeing it in the last 30 days or more or less. Any info, send to me and I'll run with it, guys.
In the screening, obviously people can get put aside who might be suspicious, but then they do an appropriate test, and if they're not infected, they let them go.
And how large are we expecting this to grow over what period of time? In other words, how quick is this outbreak going to take hold, moving to significant numbers, that is, in the tens of thousands, or do you believe that can still be stopped?
Well, I believe it can still be stopped, Lou, and it's completely impossible to predict what the scope is going to be, what the kinetics is going to be. Let me give you some examples. Sure. You might remember in 2002 and 2003 with the SARS outbreak, which was also a coronavirus that jumped species from an animal to a human. That wound up with about 8,000 infections and about 775 deaths over a period of a year and a half or so.
8,775 deaths, guys. That's like 10%, give or take. That's crazy. There's more. Now we're going to talk about Mars, I believe, or Mare.
In 2012, we had the Middle East Respiratory Syndrome, or MERS. Again, that was an outbreak of a coronavirus. That was about 2,400 cases and about 800 deaths. So we really don't know where this is going to fall in that spectrum.
How soon will you have an indication of the potentiality of this this outbreak and whether it could move to an epidemic level?
Well, I think it's going in that direction. I think we already know that it's starting to spread from human to human. And as you mentioned correctly, Lou, we're already seeing cases, travel cases in Thailand and in Japan. And it's inevitable that we're going to be seeing more cases throughout the world. In fact, in our meeting today, we heard there was now a case in France also. So this is something that will likely spread more before we actually get it under control.
And of course,
again, guys, 12 monkeys scenario. Yes, this is not a sabotage or, you know, some radical group doing this that we know of anyway. This is people that got a disease. Now, where it came from and how it started, who knows? Biological things are going on all the time. But like you just said, it's France, it's here, it's all over Asia. This is just the beginning of the iceberg. I hope I'm wrong, guys. I hope it's not even 12 Monkey at all. Because if you watch 12 Monkeys, what happens, it's kind of like World War Z kind of situation, to where it started and boom. It's hard to stop things sometimes, guys.
As I understand it, it's about a 4 or 5 day window in which there are no symptoms, but which the patient is in fact contagious. Is that correct?
Well, well, I'm not sure it's exact. We don't know the exact days with this, Lou, because we just are starting to get experience. But the incubation period is anywhere between 2 and 14 days. And we know with general viruses like this, it is often that you can actually shed virus and spread it for a day or so before you actually feel sick. Whether that's the case here with this coronavirus, we haven't determined that yet completely.
Dr. Anthony Fauci, reassuring to have Dr. Fauci.
And with that, guys, like I've been telling you, 15 days is what they've been saying here for incubation. And 2 or 3 days, you know, anywhere before you're sick, period. Whether it's a week, 1 day, 2 days, or the 15-day, 14-day period, whatever, you are a transmitter. Some people are going to get this, by the way, they're not even going to show symptoms. I guarantee you, that's how this is going to go down. So with that, remember, healthcare sucks, and I'll be on it. I'll be bringing you more. I've got more from overseas to review before I can put it out. I'll try to get that into you tonight. Stay safe, wash your hands, do what you can to protect yourself and your family, guys. This could be a bad one.